Having spent decades as a cardiovascular surgeon, I've witnessed countless senior patients enter my consultation room concerned about chest tightness, difficulty breathing, or unexpected exhaustion. What breaks my heart is seeing healthy, active seniors suddenly struggling with cardiovascular problems that seem to come out of nowhere. Frequently, the culprit isn't solely their eating habits or lifestyle stress. Instead, it's a prescription they've been faithfully taking for years, often medication originally meant to treat an entirely different health issue. The pharmaceutical industry wants you to believe that all medications are thoroughly tested and completely safe for long-term use. But the reality is far more complex, especially for seniors whose bodies process medications differently than younger adults. What countless seniors remain unaware of is that certain everyday medications consumed daily by millions of people over 60 can silently harm heart muscle tissue, elevate blood pressure readings, or cause erratic heart rhythms. These prescriptions don't immediately display warning signs, but gradually they can compromise your cardiovascular system and reduce your lifespan. In this presentation, I'll expose the 7 most hazardous medications that could be compromising your heart wellness without your awareness. This isn't about creating panic. This is about education and knowledge. If you or a family member is over 60 and currently using medications for discomfort, rest, blood glucose, or emotional well-being, you must watch this complete presentation. The first medication is the most destructive and widely prescribed. I'm not suggesting you discontinue anything without professional medical consultation, but you have the right to understand these risks. Let's start with medication number 7. Medication 7, non-steroidal anti-inflammatory drugs, NS. Non-steroidal anti-inflammatory medications, commonly referred to as NSAIDs, encompass drugs such as ibuprofen and naproxen. These treatments address arthritis discomfort, joint inflammation, or lower back pain, frequent complaints among older adults. What's particularly concerning is that many seniors treat these medications like candy, popping them whenever they feel the slightest discomfort. Numerous individuals over 60 consume them regularly, without understanding their potential cardiovascular dangers. Here's what happens inside your body when you take NSAIDs regularly. They block certain enzymes that normally protect your blood vessels and kidneys. NSAIDs can elevate blood pressure levels and promote fluid accumulation, creating additional burden on your cardiovascular system. For individuals with compromised or aging hearts, this extra pressure might be sufficient to initiate heart failure or abnormal heart rhythms. Prolonged NSAID use can harm blood vessel walls and diminish kidney performance, placing further stress on your circulatory system. If you currently manage high blood pressure or take cardiac medications, these pills can subtly interfere with your prescribed treatment plan. The effects may not be immediately noticeable, but your heart experiences continuous strain. This is why I consistently advise my senior patients to exercise extreme caution with non-prescription pain medications. Alternative pain management options exist that don't elevate cardiovascular risk. Always consult your physician before using NSAIDs for extended periods beyond several days. Pain management shouldn't compromise your heart's well-being. Now let's examine medication number 6, which poses even greater long-term dangers. Medication 6, specific diabetes treatments, thiazolidine-diones. If you're managing type 2 diabetes, there's a medication category called thiazolidine-diones, including medications like pioglitazone. These are formulated to reduce blood glucose levels, but they may quietly damage your cardiovascular system. The irony is heartbreaking. You're trying to protect yourself from diabetes complications, but the very medication meant to help could be setting you up for heart problems. These prescriptions can trigger fluid accumulation, leg swelling, and potentially lead to congestive heart failure, particularly in seniors over 60. I've seen patients whose ankles became so swollen they couldn't wear their regular shoes, yet they didn't connect it to their diabetes medication. While the purpose is blood sugar management, the concealed cardiovascular risk is significant. Many seniors with diabetes already face elevated heart disease risk. Adding a medication that increases cardiac pressure through excess fluid retention creates a dangerous combination. Even more concerning, these pills can disguise early heart failure symptoms like fatigue or breathing difficulties. Some physicians may continue prescribing them due to their blood sugar effectiveness. However, if you have cardiac history or experience mild swelling, this medication can quietly worsen damage. Always inquire about safer alternatives with your doctor. Blood sugar control matters, but not at your heart's expense. Let's proceed to medication number 5, which millions of seniors consume nightly for sleep. Medication 5. Sleep medications, sedative hypnotics. Many seniors experience sleep difficulties and depend on sedative hypnotic medications like zolpidem or older drugs such as diazepam. The sleep industry has convinced millions of seniors that popping a pill is the only solution to their sleep troubles. These pills promise improved rest but often carry serious cardiovascular consequences that doctors don't always explain clearly. What many seniors don't realize is that these medications don't actually provide natural, restorative sleep. Instead, they create a drug-induced unconsciousness that may feel like sleep but lacks the deep, healing stages your heart needs. Sedatives depress your entire nervous system, including heart rate and blood pressure. While this might seem beneficial, it actually reduces your body's capacity to respond to stress or oxygen requirements during sleep. Over time, these medications can cause sleep apnea or worsen existing apnea, a condition where breathing stops briefly during night hours. This creates extreme cardiac pressure and can trigger dangerous rhythm disturbances. Additionally, these medications can interfere with essential heart treatments like beta blockers, reducing your treatment effectiveness. Fall risk, confusion, and breathing complications increase with age, especially when combined with other prescriptions. Sleep problems require attention, but long-term sedative dependence can gradually harm your brain and cardiovascular system. Natural and safer sleep improvement methods exist without this damage. Discuss alternatives with your healthcare provider before continuing regular sleeping pill use. We'll now address medication number 4, a common mood stabilizer that might be gradually harming your heart unknowingly. Medication 4. Tricyclic antidepressants. Tricyclic antidepressants are older prescriptions used for depression, anxiety, or chronic pain conditions. Medications like amitriptyline or nortriptyline were previously common but carry cardiovascular risks, especially for people over 60. The pharmaceutical companies developed these medications decades ago when our understanding of heart health was much more limited. What makes these medications particularly dangerous for seniors is their effect on the heart's electrical system. These treatments can cause various cardiac complications, including irregular heartbeats, blood pressure fluctuations, and even a serious condition called heart block. Think of your heart like an electrical circuit. These medications can disrupt the wiring, causing dangerous short circuits. Over time, they can disrupt electrical signals controlling your heartbeat. This makes them particularly hazardous for seniors with existing arrhythmias or slow heart rates. These drugs also increase dizziness and fall risk, potentially leading to injuries and additional complications. Even with small doses, long-term use without monitoring can be harmful. Newer antidepressants exist that are much safer for cardiovascular and brain health in older adults. Unfortunately, some doctors continue prescribing these older medications from habit or cost considerations. If you're taking tricyclic antidepressants and experiencing tiredness, dizziness, or heart palpitations, don't dismiss these symptoms. Always ask your physician about safer alternatives. Next is medication number 3, something millions of seniors use daily for a common problem, but with hidden dangers. Decongestants, pseudoephedrine and phenylephrine. Decongestants like pseudoephedrine and phenylephrine appear in many cold and allergy treatments. Seniors frequently use them for nasal congestion or sinus pressure relief, particularly during seasonal transitions. The dangerous part is that most people grab these medications off the pharmacy shelf without realizing they're essentially taking stimulants that can stress their cardiovascular system. However, these pills can be extremely dangerous for cardiovascular health. They function by constricting blood vessels to reduce nasal passage swelling. Unfortunately, they also constrict blood vessels throughout your entire body, including those supplying your heart. It's like putting a tourniquet on your entire circulatory system. This elevates blood pressure and forces your heart to work harder. For seniors, this additional strain can be hazardous, especially with existing high blood pressure or heart disease. These pills can also trigger irregular heartbeats or palpitations. You might feel restless, anxious, or dizzy after consumption. That's your heart signaling something is wrong. Many people assume these medications are safe because they're available without prescription. But aging changes how your body processes medications, and what seemed harmless in your 40s can now pose major cardiovascular risk. Always read labels carefully and consult your doctor before using any decongestant medication. Let's move to medication number 2, one that seniors often take for chronic acid reflux without knowing its silent cardiovascular effects. Medication 2. Proton pump inhibitors. Proton pump inhibitors, commonly called PPIs, are medications like omeprazole or pantoprazole used for acid reflux and heartburn treatment. The advertising industry has convinced millions that chronic heartburn is just a normal part of aging that requires daily medication. Millions of seniors depend on these pills daily, believing they're completely safe. But recent research has demonstrated that long-term use can increase heart problem risk. Here's the concerning part that most doctors don't explain. PPIs reduce stomach acid, which helps with reflux, but that same acid is essential for absorbing vital nutrients like magnesium. Your stomach acid isn't just for digestion, it's your body's way of extracting the minerals and vitamins your heart needs to function properly. Low magnesium levels can cause irregular heartbeats, fatigue, and muscle weakness. Over time, PPIs can also disrupt gut bacteria and contribute to inflammation, which directly connects to heart disease development. If you're using PPIs for more than several weeks, especially if you're over 60, it's time for reassessment. These medications should only provide short-term relief unless absolutely necessary. If you're experiencing persistent heartburn, work with your doctor to identify the underlying cause rather than masking symptoms. Long-term cardiovascular health must always take priority. Now it's time to reveal medication number 1. The most dangerous and commonly prescribed pill that's quietly weakening senior hearts worldwide. Medication 1. Calcium channel blockers. Calcium channel blockers are medications frequently prescribed for high blood pressure, chest pain, or arrhythmias. But certain types, especially older ones like verapamil and diltiazem, can be dangerous for seniors. The medical community has been prescribing these medications for decades, but we're now learning that what works for younger patients can be problematic for aging hearts. While these pills effectively relax blood vessels, they can also slow the heart excessively. It's like applying the brakes too hard on your cardiovascular system. For seniors whose heart function may already be compromised, this can result in dangerously low heart rates, dizziness, and even fainting episodes. I've had patients who couldn't climb a flight of stairs without feeling lightheaded, and it wasn't their heart disease, it was their heart medication. Over time, they may cause leg swelling, shortness of breath, and heart rhythm alterations. Some calcium channel blockers can also interact with other medications seniors commonly take, increasing complication risk. The primary concern is that many seniors receive these prescriptions without regular monitoring, and side effects may be attributed to aging rather than the medication itself. If you're experiencing fatigue, swelling, or slow pulse while on these medications, it could be a warning sign. Never discontinue heart medication without your doctor's supervision, but always inquire about newer, safer options for your condition. This medication is powerful but requires close oversight. Let's conclude everything we've learned today with a final consideration. If you're over 60 and taking any medications we've discussed today, I'm not telling you to stop them independently, but I'm strongly encouraging you to speak with your doctor. The medical system often treats symptoms rather than addressing root causes, and seniors end up taking multiple medications that can interact in dangerous ways. These medications were created to help, but when taken long-term or without proper monitoring, they can gradually damage your cardiovascular system. The pharmaceutical industry profits from keeping you on medications for life, but your health should be the priority, not their bottom line. As a cardiovascular surgeon, I've witnessed too many seniors hospitalized not because of illness, but due to medication side effects. I've seen healthy, vibrant seniors become frail and weak, simply because their medication regimen was slowly poisoning their cardiovascular system. The objective isn't fear, it's prevention and empowerment. With proper awareness and support, you can protect your heart, live longer, and feel better. Now is the moment to take charge of your health. Stay informed, stay vigilant, and never hesitate to ask questions about the pills you're taking. Your heart is too valuable to ignore, and you deserve to live your golden years with vitality and strength, not struggling with preventable heart problems caused by well-meaning but potentially dangerous medications. If you found this presentation helpful, please share it with your loved ones and subscribe for more life-saving advice designed for seniors like you. Together, we can help seniors across the country protect their hearts and live healthier, longer lives. Take care and stay heart strong. See you in our next video.